Welcome back to Smitty's Learning Room. Today we're going to have a look at the focus question, what are the priority issues for improving Australia's health? More specifically, we're going to have a look at the groups experiencing inequities. So if we have a look at Australia, we know that we're a very multicultural country and we have various population groups within our societies. Now, let's have a look at some of the population groups which are experiencing health inequities. And having a look at this graph here, we can clearly identify that Indigenous Australians from a low socioeconomic status, and Australians living outside major cities, so in rural or remote areas, have a higher death rate compared to the rest of Australia. So we have a look at the 5 groups which have been identified, and we look at ATSI, so Aboriginal and Torres Strait Islander people, socioeconomically disadvantaged people, so those people living in a low socioeconomic status, people with disabilities, people in rural and remote areas, so those are areas that are outside of major cities, and overseas born people, so people who were not born in Australia. Now, these groups have been identified as groups that require extra resources and funding that help close the gap in health outcomes between these groups and the rest of the Australian population. Now, the syllabus requires us to research and analyse Aboriginal and Torres Strait Islander people and one other group experiencing health inequities by investigating the nature and extent of the health inequities, the socio-cultural, socio-economic and environmental determinants, and the roles of individuals, communities and governments in addressing the health inequities. In this video, we're going to have a look at the Aboriginal and Torres Strait Islander people, and there'll be a follow-up video which will explore people living in rural and remote areas. So having a look at the ATSI people, we know that they have a lower life expectancy of average 10 years between males and females when compared with other Australians. And although that gap is decreasing, and obviously their life expectancy is increasing, it's still important to realise that that gap still exists, and there still needs to try and improve health inequities so that that gap can decrease as well as increase the life expectancy. So you'll see from having a look at the 2 graphs here, you'll see that the non-Indigenous women and non-Indigenous men have obviously a higher life expectancy than what Indigenous men and women have. Coming down to the graph on the bottom here, you'll see that the child death rate is twice that of other Australians. So having a look at the Indigenous deaths per 100,000 population and the non-Indigenous deaths, you'll see that that's almost twice the size. When we have a look at other areas of health for ATSI people, we see that ATSI people suffer from larger death rates from circulatory diseases, endocrine, metabolic and nutritional disorders, with obviously an emphasis on diabetes. So you can see here that Indigenous people are 3.3 times more likely to suffer from diabetes than other Australians. Overall, ATSI people have a general gap in health outcomes compared with other Australians. We have a look here that they're 7 times more likely to suffer from kidney disease. They're 3 times more likely for hospitalisations for respiratory conditions. Youth suicide for female is 5.9 times higher, and also 4.4 times higher for males, and the cancer death rates are 1.5 times higher for Indigenous people as well. When investigating the inequities for ATSI people, it's really important to have a look at the socio-cultural, socio-economic and environmental determinants. Now, when we have a look at the Australia's Health 2014 report, it states that many factors contribute to the gap between Indigenous and non-Indigenous health. Social disadvantage, such as lower education and employment rates, is a factor, as well as higher smoking rates, poor nutrition, physical inactivity and poor access to health services. So obviously we can see that there's quite a few things that interact here. So when we have a look at this little pie graph here in relation to the proportion of health gap explained, you can see that over 50% of those issues are related to socio-cultural determinants. Now, when we have a look at the socio-cultural determinants of health for ATSI, we need to remember back to Year 11, Core 1, and we know that the socio-cultural determinants include family, peers, religion, culture, and the media. Now, epidemiological data reveals that ATSI families are less educated and have less money, which can contribute to the family upbringing. Now, we know that as well as the decreased income for Indigenous families, there's also increased rates of domestic violence, with 1 in 5 Indigenous adults reporting being a victim of violence. When we have a look at culture and within the Indigenous families, about 1 in 9 Indigenous Australians spoke Aboriginal or Torres Strait Islander language as their main language at home in 2008, and about 2 in 5 Indigenous adults spoke at least some words of an Indigenous language. Almost 2/3 of Indigenous adults identify with a clan, tribal or language group, which is interestingly an increase from 2002. It's important to identify that ATSI people are brought up in communities and have a really strong connection to their culture and their family and peers. The reason for this is that their communities are greatly influenced by their cultures, and this all creates a poor access to health services, with language barriers existing in some instances in really remote communities, and poor examples being set by adults for younger generations. Another concept under sociocultural determinants we need to explore is the disempowerment that ATSI people may feel as a result of many years of oppression and discrimination from non-Indigenous Australians. This can range from the invasion of the First Fleet to the White Australia policy, the stolen generation. In 2008, the Kevin Rudd government obviously started to heal this process and put out the Sorry Treaty, and which has obviously made a big difference to this level of disempowerment and trying to break down that gap of discrimination between Indigenous Australians and non-Indigenous Australians. So now we'll have a look at these socio-economic determinants, and remember when we look at the socio-economic determinants, we're looking at education, employment and income. So start by looking at education, and you can see it in the top graph here that obviously there's lesser rates of students that are actually going from year 7 all the way through to year 12. You've got rates of students going from year 7 through to year 10 are quite high. However, you've got that a decreased rate of students going all the way through to year 11 and 12, which is showing that there's a greater proportion of Indigenous students who are not reaching the HSC standards. When we have a look at the employment rates for Indigenous people, we look at the fact that less than 2/3, so 65% of ATSI people were in the labour force compared to a 79% of non-Indigenous Australians. So there's quite a large gap between ATSI population and non-ATSI population of those who are in the workforce. It's also relevant to note that nearly half of all Indigenous children were living in jobless families in 2006, and that's 3 times the amount of all children in Australia. Now, socio-economic determinants such as unemployment and poorer levels of education lead to poor behavioural choices and empowerment. So obviously we've got higher prevalence of risk factors as a result of that, and this obviously leads to lower health literacy, which basically leads to increased rates of risk behaviours such as smoking and physical inactivity, which can lead to increased morbidity and obviously mortality rates, especially from diseases such as cardiovascular disease and diabetes. The final determinant that we use to measure health inequities is the environmental determinants. So we know that environmental determinants include a person's geographical location, their access to health services, and technology. So when we have a look at the environmental determinants, we have a look at the fact that ATSI people have difficulty accessing health services, and most of these are due to their environmental location, so where they actually are located, but also due to lack of services and obviously longer waiting times. They have increased rates of rental properties, so renting homes compared to owning a house, and obviously higher rates of homelessness than those people living in city or built-up areas, and also compared to non-Indigenous Australians. And they're also more likely to live in remote and rural areas because of their culture and wanting to be part of that community culture. Finally, we're going to have a look at the roles of individuals, communities, and governments in addressing health inequities. So, obviously, individuals are empowered by a number of interventions to make informed choices about their own behaviour and encouraged to reduce risk behaviours and increase protective behaviours. Each individual is obviously responsible to promote their own health and the health of others. Obviously, for ATSI people, because of the socio-cultural, socio-economic and environmental determinants and the fact that they're quite lower compared to the rest of Australia, individuals seeking empowerment can be quite challenging and difficult. And that's where it becomes a little bit more of the community and obviously leaders within the ATSI people to have a role in addressing the health inequities. And they're still quite involved with local governments and national governments, and in particular having a look at the program Close the Gap. Now, the Close the Gap program is an initiative signed by the Australian government and basically aims to improve equity for ATSI health, and so basically improving health for Indigenous and not Australians. And to do this, they intend to decrease infant mortality and therefore increasing life expectancy, but obviously having a look at the concept of not just increasing life expectancy alongside of non-Indigenous Australians, but decreasing the gap, so trying to decrease that 10-year gap between life expectancy of Indigenous Australians and non-Indigenous Australians. Obviously, they intend to do this by decreasing risk-taking behaviours, and to do this, the Close the Gap initiative, I guess, intends to provide ATSI people with better education, better access to employment and access to healthcare to support them to empower their own health and to empower communities to provide communities that are supportive of health and supportive of equity for those ATSI communities. Now, another part that the Australian government puts in is that there's an $805 million Indigenous chronic disease package, and this is part of trying to close the gap, and that basically looks at trying to eliminate risk-taking behaviours or having a look at some issues that can improve the way that Indigenous Australians live. And the goal is to reduce the key risk factors for chronic diseases in the Indigenous community. So obviously things like smoking, trying to improve cardiovascular disease, and basically just increasing the capacity of primary care. So, do we have access to greater hospitals and nurses within Indigenous Australian communities to try and help decrease chronic diseases amongst those populations. That concludes the information on Aboriginal and Torres Strait Islander peoples. It's important to watch the second video in this series so that you can get the information on people living in rural and remote areas.